Hello, I'm Dr. Chris Owen, a GP in Ilkeston, and this film is all about diabetes self-care, how you can look after yourself if you have diabetes. Now, for some medical problems, you really have to rely on the doctor. So when the night before my final medical exams I got appendicitis, all I could do was sign the consent form and let the surgeon save the day. But diabetes is the complete opposite of that. If you've got diabetes, you can do far more to help yourself than any doctor or nurse can. Now, obviously, it's really important to go for your annual eye check and your annual blood pressure check and your annual blood tests, and to have all those checks to see if there's any problems. But in between those times, the other 364 and a half days a year, it's all down to you, and there's so much that you can do. The first thing to do is get your head in the right place. Once your head's right, your body will follow. Studies have shown that 5 out of 10 people with diabetes are actually doing really well. They're ready to make the right lifestyle choices and do fine. But 1 out of 10 people has usually got clinical depression. And if that's you, then please do speak to your GP and find out what talking treatments or tablets are available to get your depression sorted. Because once that's sorted, you'll be in a really good place to sort your diabetes. Now, 4 in 10 people are often really fed up and frustrated with their diabetes and just often ignore it and pretend it will go away. And actually, they need to get things sorted as well. If that's you and you just are fed up and just don't want anything more to do with diabetes, then why not find someone to talk to? Maybe a family member or a friend or a doctor or nurse you get on well with, or a patient group, or anyone that will give you a listening ear and help you talk your frustrations out, and then you'll be ready to get your diabetes sorted. Once your head's in the right place, the next thing to do is to watch what you eat. Now, we all know about healthy and unhealthy foods. So if you look here, there's a random selection from my cupboard. You've got nice healthy things like bran flakes, baked beans, pasta, bread, and we all know those are healthy. But actually, they contain carbs which break down to sugar, just the same as if you had a whole kilo of sugar or chocolate muffins or chocolate or crisps or biscuits. They contain carbs as well. Now, those break down more quickly to sugar, so on the whole it's better to major on the healthy carbs than the unhealthy carbs, but actually they all break down to sugar eventually. So it's worth watching how much you eat and having less than the size of your fist or less of carbohydrate at a meal. Trying to fill up your plate with vegetables and minimise how much carbohydrate you have is a really good idea. And actually, if you're not very active, if most of the time you're sitting on your sofa, then actually you don't even need a fistful of carbohydrate, you need a bit less. And if you can choose ones that take a bit of chewing, so bran flakes take more chewing than Weetabix, or CD granary roll will take a lot more chewing than a white roll, actually that will absorb even slower and be much better for your diabetes. If you really want to be keen, there's a fantastic book called Carbs and Cows that you can get on the internet or as an app. It shows you everything you could ever want to eat and the exact amount of carbohydrate that's in there. And with that, you can really get your diabetes sorted. So as well as watching what you eat, the second important thing is to get out of your seat, to exercise and move more, doing whatever you enjoy. It doesn't really matter what exercise you do. All exercise brings your blood sugar down, whether you're walking around the shops or walking around a lake, or gardening, or whatever you enjoy. I've known people do really well with their diabetes, taking on an allotment, or even helping in their friend's allotment, or walking their neighbour's dog, or doing Wii Fit. The list is endless. Whatever you enjoy is the thing for you. Because all exercise will bring your blood sugars down. I'd like to introduce Bex, who has diabetes herself and has really found exercise helpful. So over to Bex.
Exercise has got a lot of things that we don't realise how much it helps. It helps with my asthma. So not only does it help with my diabetes, which if I can get that under control will help with my circulation, my feet, and everything else. Because I understand we're at a high risk of heart disease. So I think it's really important that we try and take ownership of it, and rather than letting diabetes take control of us. And that's one of the things that I actually really like this book called Carbs and Cows. My mum was a bad diabetic, and this was one of the things that she got about a year before she died, and it went everywhere with her because it actually gave her the information that she needed. And I think that now we need to use the information that's available to us and not let diabetes take control of us, but actually live our lives as best we can.
So as well as watching what you eat, and getting out of your seat, the final one is to look after your feet. It's worth checking your feet every day and making sure there's no cuts or ulcers or problems there. And if you find anything, to phone your GP or your podiatrist the same day to get them checked out. Because the quicker you get treatment, the quicker you'll be back on your feet and able to live life again. So in summary, diabetes is something that you can do a huge amount for to look after yourself. If you can get your head in the right place first, you'll then be in the best position to watch what you eat, get out of your seat and look after your feet and really get control of your diabetes. Thank you.